This conference will now be recorded.
Thank you. This is the Medical Board's Medical Marijuana Expert Review Committee meeting, and I will briefly take the roll call. Dr. Bechtel.
Present.
Dr. Soin.
Present.
Mr. Giacalone.
Here.
Dr. Reddy.
Present.
Dr. Schottenstein does not appear to be present at this time. If he arrives, I will know his presence. We have a quorum for the meeting, Dr. Bechtel.
I'd like to go ahead with the meeting, and first of all, I'd like to see if everybody's had an opportunity to review the minutes from our meeting back in February. Or have any
I
questions?
reviewed them and motion to approve.
Okay. Do I have a second?
I second that.
Second. Okay. We have a motion to move with approval of the minutes. Can everybody agree? Say aye.
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 No opposition or corrections? Good. I think what we may want to move next to is the addition of an expert reviewer for us. We've received a CV from an application from Robert Edwin Albright, MD. Dr. Albright is a potential expert witness for us in regards to Huntington's syndrome, restless legs, spasticity, and even criminal end-of-life care. Dr. Albright went to medical school at Penn State, did an internship at the University of Pittsburgh, and then did neurology at Duke, a very outstanding neurology program. He is board certified in neurology, hospice and critical care, so I think he brings some good expertise into the area of where we need to get additional expert opinion. As we mentioned in category 4, we felt that there was enough information presented to move forward with further evaluation of Huntington's disease, restless legs, spasticity, and then terminal illness. Has anybody had an opportunity to review his CV or have any comments on that? Or Randy, do you have any comments that you wish to make?
None other than what was included in the CV and what you had already mentioned.
I did review Dr. Albright's CV. It's a unique CV. He has both expertise in neurology as well as palliative care. So I feel that we are lucky to have him coming forward to be our expert reviewer.
I agree, Dr. Reddy. He also has he maintains a certificate to recommend marijuana. So he has that extra expertise too in marijuana therapy, where he has that certification along with his board certification. So I think he really has a unique ability to provide some input into us. Ms. Luca, do we need to make a formal vote to accept him as an expert in this matter?
I don't think we did last year, but it certainly never hurts.
Yeah. Would somebody like to make a motion on accepting Dr. Robert?
So moved.
Okay. Second?
I second that.
Okay. All in favor, say aye. Okay.
Aye.
Opposed? Okay. So he's officially accepted as an expert provider. In reviewing the minutes and everything, I think one of the things that will be important for the next board meeting is that we didn't provide the board members today with a list of those petitions in category 1 that we were going to officially deny. So I think it'll be important to present those at our next board meeting so we can make an official vote on that. I don't think we also had category 3. We discussed it, but we might want to officially have category 3 too, because we have to officially reject those also. And then in category 2, we didn't have anybody, any petitions that really fit in that category. In category 4, that's where we went ahead and had public comments in regards to that. I was just going to say that, we did see that the Children's Hospital comments, again, that focus on their opposition to autism and anxiety as a qualifying condition. And I thought they really did bring forward some concerns as they did last year, concerns that, especially in the pediatric age group, that medical marijuana could possibly cause a worsening of several psychiatric conditions. It could have a long-term negative impact on cognition, intelligent quotient, ability to concentrate, problem solving. And I think that, there's also even the concern about obesity down the road and the decline in potential pro-social engagement. And I think as Dr. Schonstein mentioned when we met previously, children and adults with autism have difficulty expressing themselves, and if they're having bad feelings or feeling harmed or feel uncomfortable, they may have difficulty expressing themselves. Last year we had not only Nationwide Children's Hospital's autistic experts, but also Cincinnati Children's Hospital, and I believe also the director of Ohio Mental Health expressed their opposition. We did have some comments from physicians in favor, but limited in scope. And we have a lot of comments from the public. I didn't know if anybody had any comments on what you were able to evaluate or review, or things that would stand out. One other thing I wanted to bring up is there was a comment I thought was very well thought out, very well organized by Dr. Frederick Slezak. And he talked about, we have 22 qualifying conditions now, but he thought about maybe creating more generalized categories of qualifying conditions rather than overburdening the system with a lot of specific diagnoses. And I know Dr. Reddy commented on that in our meeting last month, that maybe looking at more broader qualifications might be a consideration. I know we have to follow the rules and regulations and statutes of the legislature, but it may be good for us from an organizational standpoint to kind of break things down in more categories too as we move forward. And I didn't know if anybody any thoughts on that. Yes, so Dr. Johnson.
Yeah, so just to your point, it makes a lot of sense in many ways to allow for broad categories. And one could argue that some of the things that have come before us arguably are broad categories. But, it is in, rule and statute. Statute 4731.302 reads, and I'll quote, "A petition shall not seek to add a broad category of disease or conditions," close quote. So, yeah, it makes a lot of sense in a lot of ways, but I'm not sure where we go from here, given the legislative intent.
Yeah, I think you make a really good point. Yeah.
Yeah, and to piggyback off of that, to your point, I don't think it makes any sense to do broad categories based on the statute. I think it's not in the law, so we can't do it. So I don't know. I don't know if it's productive even exploring unless there is a change in the statute.
Yeah, I think the statute is really, as you point out, pretty clear. I think it's a good approach, and I appreciate the comments of Dr. Slezak, but I think it may be difficult under the current rules and regulations to move forward in that way. Yes.
I would also
Johnson?
say that I'm also, I think, understanding and respectful of legislative intent not to include broad categories. I think what they're probably concerned about is essentially a creep of diagnosis, where essentially the categories become so broad that they become all encompassing. So I think they're just trying to be, specific with the thought that we can have essentially some redundancy of the conditions that we approve, rather than take the chance that the condition is too overly broad and essentially allows in areas of treatment that the legislators would not otherwise be comfortable with.
Any other comments on that? I think to kind of summarize for our next board meeting, we'll present to the full board the petitions in category 1 that we'll plan to reject. There are no petitions in category 2. In category 3, there are probably maybe several that we will reject, but we'll also have staff reach out to the people who presented those petitions, letting them know it's probably already covered. And then as we look at category 4, we'll await the expert opinion on Huntington's, restless leg syndrome, spasticity disorders, and end of life recommendations. And then after we have a chance to review those, then we can move forward with our recommendations to the board. We do have the categories of autism, and I think the other is anxiety with
Panic disorder with agoraphobia.
well, yeah. And those are ones that when we discussed at the last meeting, we discussed that, we've already had a lot of, expert testimony in the past, and that the board would serve as its own expert evaluator this time. Ms. Luca, do we want to take a formal vote on those today based on our discussions, or do we want to wait and discuss everything at our next meeting?
So you could move forward the ones that you want to reject and vote, and then the board can vote on those to reject at the next meeting. So those categories 1 through 3. And then what we did last year, and I think worked well, was that we waited and did all categories 4 together. So both the ones that the board served as its own expert, as well as the one with the expert report. So those were all then taken together.
So what we could do today is maybe potentially vote on panic disorders and agoraphobia, and then autistic spectrum disorder. Maybe discuss that today. As far as like taking a vote from our committee, or would we all do that at the same time after we get?
I think you would do that all at the same time.
Okay. Does anybody else have any further discussion on the comments that have been made? Dr. Schoenstein, did you see anything in the comments that were made that would lend any further support for autism or?
I guess, forgive me. I guess what I would say is that I thought the comments were heartfelt and heartbreaking.
Yes, they are.
And I understand that there's patients and families out there that are truly suffering from the effects of these conditions. And I know that conventional treatment is lacking in these areas, and that many patients have had minimal benefit from conventional treatment and substantial side effect from conventional treatment. So I guess what I would say is I would never lightly reject a petition for an indication for the use of medical marijuana. But I want to be, careful and sort of really think through that, my concern for these patients suffering does not sway me into approving something for them where there's an inadequate benefit, inadequate evidence of benefit, I should say, and substantial risk of side effect. I think that we would need to have the sense, I think, that medical marijuana was as good or better than the conventional therapies that are out there. So, I'm very mindful of the comments that we received by the proponents, and I'm certainly very mindful of the concerns that were raised in the Children's Hospital letter. So that's my thought.
Yeah, I would agree with your comment too. I think that certainly families dealing with autism face a huge challenge. It impacts an entire family, and therapies have not been always satisfactory. And certainly our concern and understanding really goes out to the autistic patients and their families. At the same time, we have to be cautious not to approve something that could have significant detrimental effects to that population of patients. And as was pointed out in the letter from Nationwide Children's, there are starting to emerge, clinical, well-controlled studies looking at the use of medical marijuana that will give us a lot of additional insight and maybe give us some direction for the future and guardrails on how we move forward with this. But certainly this is not something to be taken lightly and really impacts families. Bob, you wanted to comment?
Yeah, I agree with everything that Dr. Schottenstein and you have said. I mean, it is tragic. I mean, these people really have significant issues with children, but looking at the information, the one physician that commented, Douglas Wu, even, it was anecdotal. It was one individual, and then you look at Nationwide, and it's this balancing, right? You're balancing the benefit versus, the long-term negative effects of this on an autistic child. And that's such a difficult balancing act because unfortunately it's not one size fits all for everybody, right? I mean, maybe one child has a beneficial effect and 10 have a detrimental effect. How do you balance that? And that's the problem that I think we face here is we totally sympathize with parents and their children. On the other hand, we don't want to give them potentially a loaded gun that's going to make things worse either. So unfortunately, we hope that studies come through and, there is some, determination later on or some other breakthrough that can help these people because they really need it. It's just, I'm not sure I don't think this is the grail, the holy grail they're looking for. At least not today. It's not. Thank you.
Any other comments, Dr. Reddy? Any thoughts that you have?
I do sympathize with the families who have autism children affected, but just because we don't have a proper treatment, we can't approve something yet which has not proved scientifically helpful. My concern is, as I brought it before, what does medical marijuana do to a young brain later in the life? And I do not feel comfortable approving that as a treatment at present in autism.
Yeah. So I think that we'll wait for our expert reviews on those other conditions that we had mentioned, and we'll wait for Dr. Albright's assessment of the situation, and then we can make a formal vote on the autism and then the panic disorders with agoraphobia. And then I think it's important for all other community members, again, to go back and review those comments and maybe, if it's possible, Brandy, if you would be able to provide any other pertinent testimony from last year in regards to autism that from previous experts from last year to our committee, that would be wonderful that we could look at. And then Ms. Luca, do you know when we'll be meeting again? Will it be next month or I guess it depends when Dr. Albright is finished with his evaluations.
So our goal would be to, it might be aggressive. Brandy, maybe you can weigh in. I think we're looking for him to have his expert report finished by the end of April. Is that right?
Yes, that's what we had asked.
So we might not meet next month. We would wait until April. We would get his report at the end of April, and then we would bring him to the committee in May to make him available for questions like we did last year with our cachexia expert. And then we would vote at that time in May, I believe.
Okay, great. Thank you.
Is that, please, if somebody thinks that doesn't sound right, please let me know.
Any other business to bring before the committee? I think that probably concludes everything. Dr. Schonstein?
Sorry, I just had one quick thought, which is when we go to reject category 3, we're essentially indicating on some level our thought that those conditions are legitimate indications for the use of medical marijuana. And I was just thinking in terms of the public, like it could be confusing if it sounds like we're rejecting them when in fact what we're saying is that it's acceptable to recommend medical marijuana for those things. So I just think that, with regard to any information that we convey, we want to try to be clear about that so people don't get the wrong idea.
Yeah, I think that's a really important point. I think communication specifically about what you just said will be very, very important. And I'll make sure in any testimony that I make or in our meeting that I'll make that very, very clear.
We can also script the vote so that we're acknowledging that those are, we can reject petition 1 as category 1 as having not met our statutory requirements, and petition 3 we can do as a separate category of rejections because they are being moved because it's already covered.
Yes, yeah.
We can acknowledge that, and I think we should for the minutes and for clarity, for those conditions for going forward.
No, that's very important. Yes. Okay. Any other new business or discussion? I thought we could go ahead and adjourn if I have a motion.
So moved.
Okay, second.
Second.
Thank you. Yeah, thanks everybody we had a long day today, a lot of really good discussions. So it's great. I mean, it's very worthwhile. So thank you very much, and see you next month.
Thank you so
we have a
much.
quick voice vote on the motion to adjourn, please? Just a voice vote, please.
Yeah. All in favor?
There we go. Thank you very much.
Okay, thank you.
Bye, everybody.
This
Great to see you.
conference is no longer being recorded.
Thank you all.